President Obama is expected to announce plans for moving forward on health care reform this week. One thing is certain, if it involves trying to pass what's currently on the table, he'll be doing it without Republican support. So where are we going from here? Well, South Dakota Senator John Thune chairs the Republican Policy Committee and joins us now. Senator, thanks for being here.
Good to be with you, Jane.
Nancy Pelosi on the Sunday talk shows yesterday sounded pretty confident that she can have the votes for this. What are your thoughts?
She did, and so did the White House. They're all expressing optimism that they will get the votes. I think it's going to be much harder than they think. I think it's going to be as hard in the House of Representatives as it is in the Senate. You know, the lot's been made out of getting 51 votes through reconciliation in the Senate. But I think the House of Representatives, there are a lot of conservative Democrats over there who voted against this last time that are now going to be asked to vote for it. And I'm not sure why they would want to do that. And there are some who voted for it, I think, who are going to want to vote against it. So I think the math is much more complicated than they're letting on. I think the American people can have a big voice in this and a big role in this, and getting in contact with their member of Congress or their senator and letting them know what they think.
We've also heard so many people, though, in the last few hours say that Nancy Pelosi, you can't count her out. Even Karl Rove last hour said the fear is palpable in the room when she's there.
Well, I think that's true, and I think the president will be very involved. I think you're going to see all the levers of power here in Washington trying to put the screws to a lot of these wavering members of the House and the Senate, and a lot of muscle used to try and get them on board with this. But again, the American people have rejected this legislation. They've rejected the approach that's being used, and I don't know why, if you're a Democrat representing a state where your constituency is clearly against this, that you would want to risk your political future on legislation that the American people think is the wrong prescription for the country. There are things that we can do to address health care. We would like to be engaged in that discussion. We've not been. They've tried to push this through with one party starting from the very get-go, and I hope that they will back off from that. But the way that I believe we can still influence the outcome of this is if the American people get engaged and get in contact with their member of Congress or their senator.
I just want to read for our viewers what Robert Gibbs, the White House spokesman, tweeted yesterday online. He said, quote, "If we don't act, family health care coverage will go from $13,000 per year to $24,000 by the year 2020. I mean, how do you explain to constituents back home that we may, on the Hill, end up doing nothing about this on a problem that's spiraling out of control?
I think people want something done, but what they don't want is this massive expansion of government in Washington, D.C., creating this new entitlement program with lots of higher taxes, lots of Medicare cuts. And ironically, at the end of the day, Jane, and this is what the American people, I think, have figured out, this is actually going to increase health care costs, insurance costs for a lot of Americans. If you have insurance today and you're someone who is, and if you're someone who's going to get insurance in the individual marketplace, according to the Congressional Budget Office, you're going to see your insurance rates go up. There are people who will see lower insurance rates, but overall the cost of insurance in this country and the cost of health care will go up under this bill, not down. And in fact, we would be better off in terms of the overall cost of health care if we did nothing relative to doing what the Democrats want to do. There are things that can be done to bend the cost curve down. We want to be a part of that discussion, but frankly, what's being proposed will actually increase the overall cost of health care, not decrease it.
We'll keep our eyes on it. Senator John Thune, good to see you. Thanks, sir.
Thanks, Jane.